I will be talking about adrenal fatigue. This is a very important and serious topic. Approximately 90% of my patients has been diagnosed with adrenal fatigue to a certain degree. You may be asking, what is adrenal fatigue? Why are the adrenal fatigue so important, and where are the adrenal glands located? What's their function? The adrenal glands secrete hormones that help the body cope with stress. The glands are about the size of a walnut, and they sit on top of the kidneys and produce powerful hormones that sustain the whole body in its life process. As a matter of fact, we would die without adrenal hormones. The adrenal glands are composed of the adrenal medulla, which is the inside part of the gland, and it secretes epinephrine and norepinephrine. Those two hormones trigger the body's stress response to the arousal to fight or flight when we are presented with a stressful situation. They increase our blood pressure and heart rate. The adrenal glands are also composed of an exterior part called adrenal cortex. The adrenal cortex produces several hormones such as DHEA, pregnenolone, cortisol, aldosterone. I invite you to read my book, Achieving Midlife Vitality, for more detailed information on the adrenal glands and their functions. Our daily lives are full of emotional, physical, and environmental stressors that assault our health and well-being. Our daily stressors include our relationships, marital problems, divorce, illness, surgery, weight gain, raising our children in a safe environment, employment, unemployment, finances, not enough money to pay the bill, commuting on our busy freeways, environmental pollutant, problem with our neighbors, and the list goes on and on. These stressors appear in our lives and team up with our inability to deal with them effectively. They begin to slowly impact our emotional and physical well-being. We begin to experience headache, anxiety, depression, insomnia, and weight gain. Chronic stress can also lead to hypertension, diabetes, heart attack, stroke, ulcer, intestine issues, and chronic fatigue syndrome. Chronic stress places a strain on our adrenal glands, which over a period of time lead to adrenal fatigue. So when my patient says, the stress is killing me, they are closer to the truth than they realize. The stress epidemic can and does kill. There are 3 stages of adrenal fatigue. The first stage is referred as adrenal hyperfunction. During this stage, the adrenal gland releases a spurt of adrenaline in response to a fight or flight situation. The adrenaline causes a rapid heartbeat, higher blood pressure, greater alertness, and more tensed muscle. When a situation or emergency disappeared, the body returns to normal. The second stage is referred to as the adaptation stage. Being in chronically stressful environment is like being in a war zone. A person is prepared to fight 24/7 and accordingly release high level of adrenaline. These high levels of adrenal hormones harm our body in several ways and elevate the blood sugar level and cortisol level. If the body does not burn the sugar off, it will store the excessive as fat. The higher level of the sugar also stimulates insulin secretion from the pancreas. The cardiovascular system is also compromised along with your thyroid, memory, and sleep. The immune system becomes compromised, and a lower immunity can lead to other serious diseases such as cancers. The third stage is called the exhaustion stage. This is the final stage when people become very fatigued and have difficulty functioning at all. Life becomes difficult. Recovery from this stage can be a long and slow process. I treat patients at all levels of adrenal fatigue depending on the symptoms they are exhibiting when they arrive in my office. Some of my patients have a lot of difficulty getting up in the morning. Others continue to be fatigued even after 8-12 hours of sleep. Others are exhibiting craving, decreased sex drive, inability to handle any stress, dizziness, depression, PMS, irritability, insomnia, brain fog, memory loss, addiction to caffeine as energy source. Some of my patients are already suffering from full-blown adrenal fatigue, and they are chronically fatigued. Diabetes, irritable bowel syndrome, leaky bowel syndrome, and hypothyroidism. Oftentimes, it is difficult to diagnose adrenal fatigue until its late stage. One reason is the lack of adequate medical tests, and the other reason is that the symptoms are insidious and overlap with other diseases. But there are several ways to examine the body for the condition. It takes a long time and dedicated effort to recover from adrenal fatigue, but it's doable. Here are the lifestyle changes I recommend for adrenal recovery. The first and most important one is make sleep a priority. You can do this by avoiding stimulants such as caffeine or chocolate drinks. Don't discuss difficult issues with family members in the evening or before bedtime. Design your bedroom so that it has a serene environment. Partner snoring can be resolved by wearing earplugs at bedtime or finding a better solution. Taking magnesium at bedtime can help to relax you and sleep better. Tryptophan, 5-HTP, they are a kind of amino acid, can increase the serotonin. Another very important issue is the diet. You want to reduce the glycemic carbohydrate. The reason is higher sugar will trigger cortisol secretion and further increase your stress level in your body. So eat small but frequent meals. To avoid low sugar, try to eat a healthy breakfast every day. Increase your dietary fiber as that will stabilize your sugar level. Most people feel fatigued by 3 to 4 p.m. when the sugar goes low. So stop for a short break and eat a healthy snack with a cup of hot herbal tea. Eat less processed food, less trans fat and rancid fat. Doing this will reduce inflammation in your body. Eat lots of vegetables with different colors that will give you vitamins and minerals. Eat nuts and seeds, source of fatty acid. This also reduces inflammation. Reduce your stress by simplifying your life. Take control of your emotions. Release any anger or grievance that's stressing you. Exercise regularly. Practice deep breathing throughout the day. Meditate or pray. Have some fun every day. Do things and hobbies that make you feel good. Think positive. Have a flexible life plan and make change as you grow emotionally and spiritually. This may be the most important one. Do not take life too seriously. And remember to laugh, as this truly is the best medicine and it's free. I'm Dr. Sun. I can help you reach optimal health and vitality.